How is ulcerative colitis treated differently in children compared to adults? Have you ever wondered how the treatment of ulcerative colitis varies between children and adults? It's an important topic, especially since ulcerative colitis can affect individuals differently based on their age. Let's break down the key differences in treatment approaches for children and adults dealing with this condition. First, children often experience more severe forms of ulcerative colitis compared to adults. This means that their treatment needs to be more aggressive to manage widespread inflammation effectively. In fact, children are more likely to develop pancolitis, which affects the entire colon. Because of this, doctors often opt for higher medication doses relative to a child's body weight to ensure effective control of the disease. When it comes to medication choices, both children and adults may use aminosalicylates to reduce inflammation. However, children may require these medications in higher doses. Corticosteroids are also used to help induce remission, but they come with risks. Children are more susceptible to becoming dependent on these steroids, which can affect their growth and bone density. Therefore, pediatric treatment often emphasizes strategies to minimize steroid use. Doctors may start immunosuppressive drugs earlier in children to help maintain remission and reduce reliance on steroids. Monitoring growth and development is another critical aspect of treating ulcerative colitis in children. Since the disease and its treatments can interfere with normal growth, doctors pay close attention to a child's nutritional status and overall health. Nutritional support, including liquid diets, may be recommended to help restore growth. Some biologic therapies have even been shown to improve growth rates by effectively controlling inflammation. Surgical options also differ between children and adults. If medical treatments do not work, surgery, such as colectomy, may be necessary. In children, decisions about surgery take into account long-term effects on fertility and body image, especially for girls. The timing and approach to surgery may be adjusted to preserve these important aspects of a child's life. Psychological support is another key difference in treatment. Pediatric care often involves a family-centered approach, providing longer visits and emotional support for both the child and their family. This is important because children with ulcerative colitis may experience stress and anxiety related to their condition. In contrast, adult care tends to focus more on the individual patient. Finally, transitioning from pediatric to adult care is an essential part of managing ulcerative colitis in children. Given the more severe nature of the disease in younger patients, a planned transition helps ensure continuity of care and adherence to treatment. In summary, treating ulcerative colitis in children involves higher medication doses, earlier use of immunosuppressants, careful monitoring of growth, and additional psychological support. Adults typically have a less aggressive disease course, allowing for different treatment strategies. Both age groups requiring personalized treatment plans, but the pediatric approach is more proactive in balancing disease control with developmental needs.